Hi, Dr. Drake. I see that you just joined the meeting. If you do a quick audio and video check for us real quick.
Hello, this is Diane Drake.
Right, I can hear you. I can't see you though.
Oh, I bet you can now.
There we go. Thank you very much.
I'm early today. Can you believe it?
I was going to say, you're Johnny on the spot today. Very early. Thank you.
What's
Got you
going
loud
on
clear.
today? Oh, just okay.
Thank you.
All right. It startles me when they call me Dr. Drake. I am Dr. Drake, but nobody ever calls me.
Hey, Anderson, whenever you get a second, can you do a quick audio and video check for us?
All right, how's the audio?
Audio is great. Sorry, and you don't need to do video, so audio is perfect. Thank you.
Thank you much.
Hi, Miss Wagner. When you get a second, can you do an audio and video check for us?
Good afternoon.
All right, we got you. Thank you
Thank
very
you.
much. Hi, Dr. Hurt. Can you do a quick audio and video check for us?
Hi there.
All right, we got you. Thank you.
Thank you. Thanks for your patience and help.
Anytime. And Dr. O'Brien, when you get settled, can you do a quick audio and video check for us? All right, Dr. O'Brien, we can see you. Can you do a quick audio check for us?
Test 1, 2, 3. Happy St. Patrick's Day.
Happy St. Patty's Day. Thank you very much. Dr. Souza, when you get a minute, can you do a quick audio and video check for us?
Can you hear me?
We got you. Thank you very much. Mr. Sanders, when you get a second, can you give us a quick audio and video check as well?
Sure. Can you hear me?
We got you. Thank you very much. Hi, Dr. Greg. When you get a second, can you give us an audio and video check, and Dr. Shamia as well?
Yes, can you hear me?
I gotcha. Thank you.
Thank you.
Can you hear me?
And got you as well. Thank you very much. And Dr. Gocher, I believe you just joined as well. So when you get a second, if you can do a quick audio and video check for us.
Okay, I have my video on. Can you see me okay?
I can see you and hear you. Thank you very much.
Thank you very much.
Hi, Miss Roma. When you get a second, can you give us a quick audio and video check?
Can you hear me?
I can hear you and see you. Thank you very much. I'm Mayor Jacobs. When you get a second, can you give us a quick audio and video check?
Hey, this is Mayor Jacobs. I was muted. Sorry. I had you
You're
muted. Sorry.
fine. We can see and hear you. Thank you very much.
Dr. Gocher, if you're talking, you're muted.
Oh, I'm just about ready to start talking though. It's 5 o'clock, and so it's time to call our Board of Health meeting to order this evening. And the first order of business will be roll call. So who is conducting roll call for us this afternoon?
I believe Anderson will be doing roll call.
Okay, so Anderson, if you could lead our roll call for us this afternoon.
Good evening, everybody. This is Anderson Little with the Knox County Health Department. I'll start with our roll call. Dr. Drake. Thank you. Dr. Gocher,
Here.
Dr. Hurt,
Here.
Mayor Jacobs,
Here,
Dr. O'Brien,
Here.
Dr. Shamia,
Here.
Dr. Souza. Here. Ms. Wagner,
Present.
Dr. Buchanan,
Present.
and Ms. Roma.
Here.
Thank you very much.
So if we have had, I think we have everybody here, so we've established a quorum. And the next order of business is our public forum. And who will be conducting our public forum administration?
That will be me also.
Okay, so
Hi. Mhm.
if you want to, we can go ahead and start that. And then
Okay.
after that, we'll have that Board of Health member comments to the forum.
Okay, this is Anderson Little with the Knox County Health Department. Up first, we have Richard Cunningham. Dr. Cunningham, please state your name and address for the record, and you will have 3 minutes.
Thank you. Richard Cunningham, MD, 1836 Bombay Lane, also 402 South Gay Street, City and County. I'm a board certified orthopedic surgeon for over 25 years, small business owner, also part owner of a restaurant in South Knoxville. First, I want to thank the Board of Health, with special thanks to Mayor Jacobs and Mrs. Roma for responding to my many calls and emails about these important issues. It is clearly time to rescind any and all mandates. I had many friends and colleagues in the restaurant and hospitality industry that have been devastated by the closures, limitations, and curfews imposed over the last year. Many have not survived. Those that are still around are suffering major losses with layoffs and loss of income, yet the bills never stopped. I know of no group that has made more sacrifice and have gone over and above to assure hygiene, cleanliness, and safety. It is in no restaurant's interest to have customers or employees become ill from COVID or anything else. They have been unfairly damaged with these restrictions, and they must be lifted. Multiple states have removed any and all restrictions on restaurants and bars, and it is past time for Knox County to follow suit. If you recall, the major reason given for closures and restrictions was to not overwhelm the hospitals. So let's look at hospital capacity. These are current numbers from today's Knox County website. Sustained reduction in new cases, green. Hospital capacity, green, 31 currently hospitalized. Beds available, 24%, or 739, with another surge capacity of 4,389. ICU beds available, 14%, an average number, with 46 of 317 with surge capacity of another 543. Clearly, our hospitals have plenty of capacity, and thanks to schools finally being open, we have more staff available to staff them. If the reason for restrictions is to not overwhelm hospitals, that reason has disappeared. Why are the numbers down and continuing to improve? Many of us have had COVID, recovered, and now have antibody immunity, including myself and many thousands of others, including some on this very call. Combine that with increasing vaccinations, and we are rapidly approaching herd immunity, if not achieving it. I sent all of you an email linking Dr. Macary's article from Johns Hopkins stating as such. Lastly, it's time to remove the mask mandate. We can argue for or against, but one thing is certain: they either work or they don't. If you believe they work, the beauty of removing the mask mandate is that you can continue to wear them as long as you like. But masks have become a divisive force. I have been yelled at in my own building, despite the person being unaware that I have COVID antibodies and donate convalescent plasma to help those severely ill with COVID. Yet I'm yelled at and shamed for not wearing a mask in my own building. Wear the mask if you want, but the mandate must go. Knox County citizens have been through a lot this past year, as have many others. Our numbers are way down and trending further down. Our hospitals have significant excess capacity, and our citizens know how to take care of ourselves. The mandates must go. It is time. Thank you very much.
Thank you, Dr. Cunningham.
Next up, this is Anderson Little with the Knox County Health Department. Next up for our public forum is Aaron Snookles. Aaron, please state your name and address for the record, and you also will have 3 minutes.
All right. Hey, my name is Aaron Snuckles. I live at 7600 Westdale Drive in Knoxville. I'm here to talk to you a little about events and event facilities. We'd like to ask that they fall under the same rules as restaurants, a 50% capacity the way it is right now. We can take temperatures upon entry. We have a guest list of anybody who comes to these events for contact tracing, and we can set up social distancing because it's a tent or it's an event space that we can set up the way we want. We can operate as safely as in these events as people as weddings or funerals or gun shows or boat shows or other events that are currently allowed. We are responsible and credible businesses. And of course, we'll follow any rules that you guys set for us. We're just asking that if we could be treated just like a restaurant. We're willing to do whatever you tell us to do, but we have so many people out of work and we have lost so much revenue that we just think if you could just let it up a little bit, it would help us grow our business again, put people back to work. I mean, you could think of all the people related to events, from a wedding to a nonprofit luncheon fundraiser that you can't even have anymore. So we're just asking if you could possibly treat event spaces like restaurants, and we'll follow the guidelines that you set for us. And I appreciate all that you guys do, and happy St. Patrick's Day to all of you.
Thank you very much.
Thank you.
Last up for our public forum is Terry Turner. Please state your name and address for the record, and you will also have 3 minutes.
Thank you. My name is Terry Turner. I live at 9628 Stone Canyon Lane in West Knoxville, and I'm the owner of All Occasions Party Rentals on Middlebrook Pike. And I appreciate the time given to me today, and I appreciate all that you guys have done over the last 12 months to ensure that we are getting through this pandemic safely and effectively. So I'm also here to talk about the event industry. Having been in it for over 30 years, I do think that it is time that we are allowed the opportunity to open back up, get things rolling again. We have the capabilities, just as restaurants do, to limit our capacities. We can, for instance, in an outdoor event, we can spread out and we can increase tent space. We have all these different opportunities and ways that we can begin to gather effectively going forward. Our business, as a for instance, I know we are down about 60%. And as Dr. Cunningham stated earlier, the bills go on. We've managed to keep most of our team. But between my two companies, we're down about 40 to 50 staff. And that's significant for us. That's about half of our staff between the two companies. There's also a significant amount of other people that are unemployed, the DJs, the florists. I estimate that based on our company size, that there's probably 500 to 750 jobs out there that have not been able to be refilled. We have about probably $30–40 million in revenue, I think, that we have lost in this last 12 months. Unfortunately, I think some of that revenue may have been lost to surrounding counties, and some of those events, festivals, car shows, they may never come back to Knox County. They may have found their new home in Sevier County or Blount County and some of the other surrounding counties that opened up sooner than we were able to here in Knox County. So we would like to ask for the same requirements that you are allowing for restaurants, and that is to open back up at 50% capacity. I think we need to be clear and with the message of how we would like events to open up. Give us the guidelines. Let us operate safely. A lot of us have made substantial investments into hand sanitizing stations, hand wash sinks, air purifiers. So we think that we have the ability to open up and do it safely. And lastly, typically these meetings, I feel like I know each one of you personally because I've probably watched over half of them. But they always end, no matter what you read, with, but please limit your social gatherings to 10 people. And I know upon other conversations that that's not necessarily the message, but that's the message that people hear. So I would also like to beggingly ask that we discontinue the admonishment at the end of every meeting or at the end of anything that's written about the meetings, that we limit our social gatherings to 10, because I think that has been very detrimental to our industry as well. So thank you for your time. Thank you for allowing me to speak today.
Thank you, Mr. Turner. Anderson, is that all of our public forum members this evening?
My apologies. Yes, sir, it is.
Okay, so we want to thank our guests in the public forum this evening. And the next order of business for us is health member comments to the public forum. So we'll open the floor for discussion regarding our public forum this evening. Comments. We had two folks that have discussed the event industry, and I believe we've also received emails, all of us, on that. Any discussion on that? I think we're going to be bringing that up later, but any discussion relative to the discussions that we just heard from any one of us?
Yeah, I was going to just add that all those things are on our agenda tonight that we're going to be discussing them.
Okay. So again, to the public, all of these topics I think will be discussed at some point in the meeting tonight. So as always, we appreciate input, both the email input and your in-person input. So with that, our next order of business is to approve the minutes from our February 24, 2021 meeting. These should have been distributed to everyone, and hopefully you've had some time to look over them. If there's no preliminary discussion, I'll take a motion and a second for approval of the minutes, then we can discuss them further.
So moved.
So
Second.
I make, yeah.
second, any discussion on the minutes of the February 24th meeting? If not, we could have a roll call vote on this. So Anderson, if you will conduct our voting roll call this evening for approval of the minutes for this evening.
All right. This is Anderson Little with the Knox County Health Department, taking a roll call vote for the approval of the minutes, starting with Dr. Drake. Was that a yes, Dr. Drake?
Yes, it was. Yes.
Thank you. Thank you. Dr. Gocher,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan,
Yes.
and Ms. Roma.
Yes.
All right. It's unanimous approval. Thank you very much.
Thank you very much. You have approved the minutes from February 24. The next item is to set the agenda, and the agenda has been distributed before, and hopefully you have it in front of you. Is there any preliminary discussion on the agenda? If not, we'll accept a motion and a second for approval of the agenda as printed.
Dr. Gocher, two things, and they're related to items 14 and 15. 14 was mine, the discussion of probable, less probable scenarios in 3, 6, and 12 months. 15, I'm not sure whose that is, but review of Board of Health escalation and recession metrics. First of all, mine was very much 14. My intent was probably what 15 is as well. So I'm not sure that we need both of those. My idea was that I wanted to talk about scenarios and what has changed related to those metrics. But I think probably just as importantly, I wonder if we should discuss those before. I mean, that discussion is going to really roll into everything that follows, including guidelines for caterers and event venues. And so it just would make potentially more sense to talk about recession metrics first before we get into the real content and specifics.
So specifically, Dr. Shamia, where would you like to insert it in the agenda? Would you like to have it after we have our educational institution report, or would you like to have it as the first order of business before our benchmark report? Where would you like to have it inserted?
So I would move that we strike 14, which was mine, and then roll it into 15 and just put 15 after update on Governor Lee's executive order.
So it would be 15 would turn into 13. Is that correct?
Right.
Everything would be shifted down from there.
Right. And we can get rid of what is currently 14.
So we had a motion and a second on the agenda, and we have I would say a friendly amendment to the agenda. Are the motion and second folks okay with the friendly amendment?
I'm not sure if we actually did have a motion and second, but I'll motion and I'm happy with the amendment.
Okay, very good. Sorry about that. I was jumping ahead just a bit. Did we have a second on that?
I'll second.
Okay, so a motion and second as amended by Dr. Shamia. And that's going to be to move that up just a bit. Any other discussion on that at all? If not, since we're ready to vote, so Ms. Little, if you will conduct that roll call vote for us one more time. This is on the agenda as amended.
Okay. Thank you. This is Anderson Little with the Knox County Health Department, and I'll take your votes. Dr. Drake,
Yes.
Dr. Gocher,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Dr. Shamia,
Yes.
Dr. Sousa,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan,
Yes.
Ms. Roma.
Yes.
Thank you all very much.
Thank you. We have adopted the agenda for this evening. So the next item on the agenda is the Knox County Health Department's benchmark presentation with Dr. Buchanan. So Dr. Buchanan, if you have your presentation ready, we are ready.
I do have things ready. Charity Menifee will be sharing the screen this evening. So I'm going to begin with an update on our vaccines. As of Friday, we are vaccinating people at the Broadway site. We're very excited about that. Really happy to be in that space. Pleased on how it's going to this point. As we've said before, the space gives us the ability to offer vaccines in a regular manner at a consistent location and not have to move or find new locations. Right now, we're vaccinating anywhere between 400 and 500 people a day with first doses, with plans in the near future to increase that to 800 to 1,000 people a day. That will include both first and second doses. And as we get our flow down and get our rhythm in that space, we may increase those numbers, and we're hopeful that we'll be able to do that. But I'm also really excited to share this data with you because of the incredible partnership we have with public health, the hospitals, and our medical providers across the community. More than 144,000 vaccinations have been reported among Knox County residents. So that's almost 20% of the people having at least some level of protection against COVID. And it's great news and something that we hope to continue to build upon. Each week, new providers are added. Unfortunately, each week our vaccination allotment doesn't go up all that much, but it does go up some. So we'll continue to update those numbers Monday through Friday. And now I'll move on to the local situation. We have 47 new confirmed cases since yesterday, 947 active cases, I'm making up numbers tonight. 40 Knox County residents are currently hospitalized. And sadly, we have one more death to report, bringing our total to 596. We want to take a minute to recognize the decline of active cases and hospitalizations. The numbers over recent weeks have been very encouraging to see. And back in December, we were seeing hospitalizations well over 100 and active cases topping 5,000 a day, or topping 5,000, excuse me. Today, it's a fraction of that. This is incredibly encouraging and proof that we're moving in the right direction. That said, we want to remind everybody to keep up the 5 core actions so we can continue this progress. Be much like starting a weight loss program and deciding to stop in the middle when you've lost a few pounds. You're not going to make it to the end. As we've said, or like a marathon runner, we don't stop running at the 24th mile of a marathon. So we can't stop practicing the 5 core actions. For a note on housekeeping, beginning this week, we'll be shifting to reporting COVID-19 data Monday through Friday, data from Saturday and Sunday, and holidays will be available the next business day. This is in keeping with change in this at the state level. Tennessee Department of Health made this change last weekend. And now we'll turn and look at the benchmarks. Since we have moved to monthly meetings, we wanted to present the benchmark data to you in a way that narrows in on the trends we are seeing since the last time we met. To do that, we will show you a PowerPoint presentation today. The colored vertical lines represent the traffic light color for that reporting period. As a reminder, all of our typical benchmark data is available on our website, and you can find it at covid.knoxcountytn.gov/case-count. The first benchmark, sustained reduction or stability in new cases for 14 days. Since mid-February, you can see a downward trend of new COVID cases that has plateaued in recent weeks. For the past several weeks, this benchmark has continued to be represented as green due to lower volume of new COVID cases across our community. Over the past 2 weeks, we've seen a daily new cases drop to approximately 56 cases per day, which is consistent with previous reporting periods. It's important to note we are seeing these figures leveling off to more of a plateau. We want to see these numbers decrease and not level off. So we continue to urge folks to practice the 5 core actions and get vaccinated when able to reduce the spread of disease in our community. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test turnaround time. Regarding lab turnaround time, this figure has been pretty consistent over the past month at less than 2 days for the entire community. For this reporting period, we are sitting at just under a day and a half. Regarding testing, we continue to see low numbers, but they have remained relatively consistent. In the past week, there have been 4,800 tests conducted across the county, which is 200 more than last week. We're hopeful that the decreased testing in recent months is an indication of lower burden of disease across the county, but we continue to keep a close eye on this metric. Our third benchmark, sustained or increased public health capability. The goal is to increase vaccine distribution across the county. From mid-February to early March, you can see that we were pretty consistent at around 15,000 vaccinations provided across the county. During the past 2 weeks, we saw that number jump up to 21,000 vaccinations given. It's a big jump and is extremely encouraging. As you can see, we're trending in the right direction, but we recognize that not every provider who wants vaccine is able to receive it yet. While supply is increasing and access is improving, it's not quite where we want it yet. For those reasons, we are continuing to represent this benchmark as yellow. Fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. Over the past month, we've continued to see the number of hospitalized COVID patients decrease. It has been a relatively steady decrease with a bit of plateau in the recent days. After speaking with our hospital partners, they've recommended that we continue to represent this benchmark as green. Fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. Over the past month, the number of deaths has decreased. Back in February, we were seeing an average of 2.5 deaths per day. In the past 7 days, we are seeing an average of less than 1 death per day. While this is encouraging, we want to see this continue to trend down and not plateau. According to the White House report, Knox County and Tennessee as a whole are still yellow for deaths related to COVID. With this information available, we are representing the benchmark as yellow. So I'm happy to answer any questions about the data or vaccinations.
Any questions or comments? Dr. Buchanan, I have a question. So we've seen these benchmarks trending over the last few weeks from yellow in some cases to green, or maintaining green, and the deaths have gone from red to yellow at the last meeting and sustained. What is the criteria to switch from yellow to green in terms of deaths?
I'm going to let Charity talk about that, as she's more involved with our epidemiology staff than I am.
Okay.
Hey, this is Charity at Knox County Health Department. That one's been a tough one. There's not a great national benchmark for that. And so what we've been looking at, what we looked at today is we've been having this discussion a lot every week as we're seeing that number go down, is relying on the expertise of the federal government and the White House report and CDC. And so keeping a close eye on what their metric is. They don't have in the most recent iterations of the White House report, what they're basing that on isn't in there. And so that's where we're trying to wait and get more clarification. But they do have color rankings, basically comparing 1 month to the next, which is a really good way to look at it, considering that we try to look at things over 2 incubation periods. So that's about 28 days. And so their guidelines have been pretty clear at looking at decreases over those month time periods. So I guess all of that to say is we're trying to get a really good handle on where that should sit. But I think right now, looking at how the state or the federal government's looking at it is our best metric for that.
So Charity, does the federal government set those benchmarks for every county in the United States, or how they set it, specifically for our county? Have they
Yes,
done?
so again, they're comparing for every county by county from month to month is what they're looking at. And again, the White House Task Force reports are now available online. And so there's a little bit of a change. There's not as much explanation in their data anymore, but they're still keeping track of it. So we're waiting. I think there'll be an update, I'm hoping, in the near future with more explanations, but we just don't have that right now on how they're viewing it, but relying on what their guidelines and recommendations are. And again, very much for that metric, they're looking at changes from month to month and improvements.
Okay, great. Thank you. And Dr. Buchanan, do you have any additional information on your report this evening?
I don't. That completes my report.
Okay. Any questions or any comments from board members on that first report this evening?
This is Maria.
That's what our percent positivity is currently, if you know that. I would like to know.
I have it on the next presentation when we talk about escalation and metrics, but I can, hold on, let me look on the website. I can get it for you too real quick. I don't have it on the top.
We can be patient, Charity.
It's coming.
Okay.
This is Maria. Yeah, this is Maria. I have a question for Dr. Buchanan or Charity. So we know nationally, the good news is, numbers have dropped, cases have dropped, hospitalizations and deaths, and we've kind of plateaued out nationally to summer surge levels. So things have gotten better, but they're not all better. And I'm wondering how we locally compare to the national picture in terms of plateaued compared to our first surge.
I have to go back and look at that. I haven't looked at it in I haven't looked at it this week, so I don't want to misspeak, but we have been overall trending very similar to what's happening with the national picture overall. So I can look at that while we're talking and maybe come back and revisit it, but I don't think it's anything. I know for the state, we're definitely trending along with what we're hearing from our partners across the state when we've been talking about it as well.
Great, thanks.
Thank you. Any other comments or discussion on Dr. Buchanan's report? If not, again, thank you very much, Dr. Buchanan. And the next item on the agenda is going to be the University of Tennessee Medical Center's data update from Dr. Shamia.
Thank you. So.
It's coming.
Okay, thank you. So next slide, please. I think that skipped maybe a little bit there. Thank you. So here we see new cases by week. This gives a little bit of perspective on one of the recent questions, but you see that Knox County has really continued to drop week by week. And at those last 2 weeks, 719, 577, you can look back and see that it was probably in the September timeframe where we were last seeing those types of numbers. The district has more plateaued, whereas the county has dropped these last few weeks. Next slide, please. This just shows a comparable pattern across the state. So it doesn't give us, Dr. O'Brien, the whole country, but you see that we're dropping similarly across the state. Next slide, please. So the age demographics, you see in the 71 and older group, very little disease being diagnosed. The 51 to 70 group is a little bit more of a plateau, and whether that's because these groups have not been in the vaccination phase as long, is it possibly related to other issues, or is it just that it's we need to give it a few more weeks? So we'll see, but still a favorable trend across all the decades. Next slide, please. So this is a version of the positivity rate. I have to be clear that the way that text box, we've put that up before, but it describes that this is calculated a little bit differently than what's on the website. The reason for that is there was a period of time where the TDH would dump a lot of results all in one day, even if they didn't all come that day. And so this essentially takes all of the positives and all of the tests over 7 days and takes that 7-day average as opposed to averaging a bunch of individual days. That being said, they're generally pretty close, but I just wanted you to understand if the numbers don't line up. But this has a nice drop still at 11.2%. Next slide, please. So hospitalizations, the data lag we've always described is less now that there are fewer cases and fewer hospitalizations. So these are new hospitalizations by week and month, and it probably is a little more reflective of what's recently happened than it has been in the past. And you see, the county has declined, whereas the district is a little more of a plateau. Next slide, please. And then the day-to-day number of patients in the hospital census, every 2 weeks that we were meeting, we were seeing this drop and drop and drop. And I think consistent with what Dr. Buchanan mentioned, there's been a little bit of a plateau, still at a much lower number. You see we're at 111 right now, but that steady drop has seemed for the time being ceased. And that is mostly compatible with what we've seen on our capacity calls, which we still do at 1 o'clock across the community. It's been a little more of an up down here locally across the hospitals. But on the whole, it's leveled off. Next slide, please. And these are simply those projections. And that also shows that the most recent projection is a flat horizontal line. But I've always said I wouldn't take too much of that until we get a few lines, a few weeks lines that are in the same direction, basically. So Dr. Gocher, I think that wraps it up for me.
Okay, thank you, Dr. Shamia. Any comments or questions from board members on the presentation from the UT Medical Center? If not, as always, Dr. Shmia, thank you very much for that report and for your discussion that's going to follow later this evening. So the next item on the agenda is reports or questions from our educational institutions. And I believe we have our UT representatives here. Any additional information to the University of Tennessee's report?
Thank you. It's a pleasure to be with the Knox County Board of Health again this evening. This is Dr. Greg from over at the Student Health Center. Since our last meeting, our metrics that we routinely monitor on campus, our numbers have generally either been trending down or staying about the same. Certainly our data demonstrates that our new cases on campus have been decreasing and our active cases have been just generally holding steady. However, we have seen a slight increase in our number of self-isolations just over the past couple of weeks. These have been related to both on-campus housing and off-campus event clusters, where a number of positive cases and close contacts were identified. To this point, we're pleased with what our data has generally shown, but obviously we don't want to see these increases develop. In that regard, these recent clusters are concerning, as is the potential for the increasing prevalence of COVID variants that may have greater transmission rates and potentially less susceptibility to our current vaccines. So we obviously want to continue to emphasize the importance of adhering to the 5 core actions here on campus. In regard to vaccinations on campus, we've steadily been increasing their availability and we'll continue to do that. In fact, this Friday, March 19th, we're hosting an 1,100 dose event with the Johnson & Johnson Janssen vaccine. And so to conclude, on campus, we fully recognize that with the beautiful East Tennessee spring weather and with the vaccine's greater availability, we're all tempted to let our guard down. But we'll continue to emphasize the importance for everyone on campus to continue adhering to mask wearing, social distancing, and the other health and safety strategies that have been so successful in curbing the pandemic to this point.
Dr. Greg, thank you. Questions or comments for Dr. Greg while he's with us this evening? If not, again, we really appreciate your efforts and appreciate your report this evening.
Thank you.
Next up is on the educational institutions will be Knox County Schools. And we have a report. Ms. Wagner, do you have any additional comments or discussion on that report?
Our cases continue to decline and East Tennessee Children's Hospital continues to vaccinate the staff. So that's all. I'll take any questions if anybody has any.
Any questions or comments on Knox County Schools? If not, thank you for your report and thank you for your continuing efforts on all that. So next on the agenda, item 11 is discussion of upcoming legislation affecting boards of health by Dr. Cahill at UT Baker Center.
Thank you so much for the invitation. If I may share my screen. So I was asked to speak about upcoming legislation affecting boards of health. Much of this legislation is actually still in play in the state legislature. So what I talk about this evening is subject to change. I just want to highlight that. So just to give a general overview, county boards of health, the powers and duties for those are detailed in Tennessee Code 682601. There are 6 counties with independent health departments: Davidson, Hamilton, Knox, Madison, Shelby, and Sullivan counties. And there are 4 counties with county health boards: Davidson, Knox, Madison, and Shelby. So in terms of county health boards, there's some recent legislation that's been introduced. It's House Bill 7 and Senate Bill 15. The House bill is sponsored by Representative Jason Zachary, District 14 of Knox County. It was filed in November and it was passed by the House on March 11th. Just a few days ago. Senate bill was sponsored by Senator Mike Bell, District 9 of Bradley, McMinn, Meigs, Monroe, and Polk counties, and it was filed in December, and it was placed on the Senate Health and Welfare Committee calendar for today, actually. So that's why I say that much of this legislation is actually very much still in play and being discussed now. So this is actually from a little bit earlier today, and I can already see that there's been a slight update. But generally, so on the left, you see the current code, which delegates powers to County Board of Health and details those powers of the members. Here, section F2 and F3. So the current code gave the county health director or county health officer both the power to enforce such rules and regulations as may be prescribed by the commissioners, essential to the control of preventable diseases and the promotion and maintenance of the general health of the county. Part 3 allowed for the adopt rules and regulations as be necessary or appropriate to protect the general health and safety of citizens of the county, and the regulations shall be at least as stringent as a standard established by state law or regulation as applicable to the same or similar subject matter. Regulations of a county board or health supersede less stringent or conflicting local ordinances. Here we see on the right is the revised this is from the House Bill 7 with the proposed amendments. Like I said, it's already changed a bit. And so here you can see the revised language in purple. And so it was the addition here of unless there's an actual or potential public health emergency as determined by the county mayor, then the County Board of Health may only advise the county mayor on the enforcement of such rules and regulations. And so in the context of a public health emergency, which is to be determined by the mayor of a county, then in that case, the county health director and county health officer would become advisory, as well as in the second tab here, we can see the purple language, unless there's an actual, again, potential public health emergency as determined by the county mayor, then the County Board of Health may only advise the county mayor on the adoption of such rules and regulations. This act takes effect upon becoming a law and the public welfare requiring it. So that's the additional language that has been changed there between the current code and the revised code. I've done some clips of the discussion here about what this amendment means, what this bill means with the amended language. And so I'm just going to play it for you here.
Can you explain the amendment and how that changes your bill?
Chairman Zachary.
Thank you, Mr. Speaker. It just narrows the scope. That's all it does. So from the original bill that was fairly broad, the amendment just narrows the scope to 682601, which is just the section of code dealing with the health board. This piece of legislation doesn't have any impact on the powers of the health director, the health department, or the mayor. The first draft was very broad. This has been narrowed down to just TCA 682601.
And then in some additional context.
Can you explain the amendment and how that changes your bill? The health board as it exists now has the ability under present law to curtail our activities that it deems to threaten basically public health. How will this change their ability to curtail activities that they would deem to be against public health?
Chairman Zachary.
Thank you, Mr. Speaker. So this legislation would apply if there is an emergency situation in a county. They would move to an advisory board.
So in general, in summary, what the bill seems to suggest right now, although as I said again, it has been changing, is the legislation as it stands would remove authority from the Knox County Board of Health and any other counties and Tennessee with health boards or that form one in the future, the authority to adopt and enforce public health orders, rules, and regulations during times of actual or potential public health emergencies as determined by the county mayor. However, the legislation does not change the authority, role, or responsibility of the county health director or the county health officer under Tennessee Code 682608 or 682609. And you heard Representative Zachary talking about that distinction. And then finally, Governor Lee's Executive Order 77, Section 13C also gives the authority of the county health department to issue COVID-19 public health orders at least through April 28th, 2021. And so right now, this is still very much up in the air, but really, if it were to pass, it is likely that it would affect the ability of the Knox County Board of Health and any other similar boards from creating rules, regulating, or enforcing such rules in a time of emergency. There was also an additional bill regarding agriculture and county health boards. So this bill, House Bill 1163 and Senate Bill 1368. 1163 was sponsored by Representative William Lamberth, District 44 is part of Sumner County. It was filed in this February, and it was currently recorded for to pass if amended by the Health Committee, and it's been referred to the Calendar and Rules Committee as of March 10th, 2021. So they're still scheduling on that. The Senate Bill 1368 was sponsored by Senator Mike Bell, District 9 again, same senator who sponsored the previous bill, and it was filed on February 11th, 2021, and is currently placed on Senate regular calendar to be discussed tomorrow, March 18th, 2021. And here is Representative Lambert. Oh, I'm sorry. Here's the Tennessee Code. So essentially what this affects 682601, the County Board of Health members' powers and authorities. And so what it does is it actually adds a section, it moves section existing G into a new section, a new designated section I, and then it would revise section G to read, this part does not grant a county board of health the power to prohibit or regulate agriculture as defined in 13-105. And then an additional section H, county health departments shall not regulate agriculture as defined in 1-105, except as otherwise authorized under state law. Section 2, this act takes effect upon becoming a law, the public welfare requiring it. So essentially, the proposed bill here with amendments is to ensure that county health departments don't have any authority to regulate agriculture in the state. And here is Representative Lamberth briefly explaining the purpose behind the bill.
Very simple bill, and I would like to say I've worked very closely with Farm Bureau on this, and this takes care of an issue where a local county board of health or county health department does not have the ability to regulate agriculture. So they have an entire department that handles that. These health boards have a role that they play. It's very important in our communities, but it's just not in agriculture. So the Department of Agriculture handles that, and this kind of just keeps everybody in their own lane.
Okay, do we have comments or questions about this bill? If none, if there are no objections, we will be voting to send this bill to the full committee. All those in favor say aye.
And so that was it getting sent out of the health subcommittee to be voted on. And like I said, the Senate bill is going to be discussed tomorrow. The final bill that is being discussed is immunization, regarding immunization. And so this is House Bill 13, which is sponsored by Representative Bud Halsey, District 2, part of Sullivan County. It was filed in November and was placed on calendar for the Health Committee for today. Actually, they just wrapped up their hearing just a little bit ago. And then the companion bill in the Senate is Senate Bill 187. It's sponsored by Senator Janice Bowling, District 16 of Coffee, Franklin, Grundy, Marion, Sakatchee, Van Buren, and Warren counties. And that was filed on January 15th, just a few months ago, and passed to second consideration on February 10th. It's now been referred to the Senate Health and Welfare Committee for future discussion. And so in terms of this code, this is actually an addition. This would create a new section to the code 685-1 on prevention of diseases, general provisions. And so would add this language, a law enforcement agency or governmental entity of this state or a state government or the governor or chief executive of a local government by executive order shall not force, require, or coerce a person to receive an immunization or vaccination for COVID-19 against the person's will. Section 2, this act takes effect upon becoming law, the public welfare requiring it. And so this would be an additional section that would limit any requirement or coercion for a COVID-19 vaccination by essentially any entity. This is the last, this isn't today's discussion, but this is the last discussion about a previous change and amendment that didn't pass, but I want to give you a sense of the conversation that's being had in the Health Committee about this particular bill.
It's obvious, should be obvious to the sponsor and those at home that the committee is not in favor of the original language. I have worked with others and the member who brought this and offering this amendment. One of the major concerns of the sponsor is that he brought forth is the fear and concern, particular as it relates to a non-fully approved or a a vaccine that is under emergency use authorization. And while I may not believe that the state could require that type of vaccine, the amendment makes it clear that the state cannot require any COVID-19 vaccine that is not fully approved or still operating under emergency use authorization. And the amendment also removes the words force and coerce from the original bill.
And so this amendment then went on to be debated. It was not passed, the amendment, but there was quite a bit of discussion among members about the likelihood of the bill passing in its original form. And indeed, in today's meeting, they decided to, the sponsor of the bill, Halsey, in the House, requested to table it for the last calendar session to see if the bill got more traction in the Senate. Which he indicated had some uncertainty surrounding it. So I think that it's going to be some time before we are able to actually discuss the bill in its amended form before the state legislature. So Immunization Authority generally, just to give some insights here, the U.S. Supreme Court issued a ruling in February 20th, 1905 in Jacobson v. Massachusetts, which upheld the right of states to compel vaccination. That was in a case regarding a smallpox vaccine. And there was a gentleman that did not want to be vaccinated, nor did he want his children to be vaccinated because he had previously been vaccinated in Sweden and had had a bad reaction to it, was concerned. And he was fined by Massachusetts and threatened with additional penalties for failing to be vaccinated. And so the case went all the way to the U.S. Supreme Court, and it was determined that the state did have the right to compel vaccination. So this law, if passed in its current form, would actually be the state giving up some of its authority in this area. So each state decides which vaccines are currently required based on recommendations for the Centers for Disease Control and Prevention Advisory Committee on Immunization Practices. Many of you are probably familiar with immunization requirements, for example, for school children, and the related practice of allowing for exceptions for religious or other reasons, health reasons, that most states employ, including the state of Tennessee. Immunization or vaccination, to be clear, for COVID-19 is currently not required by any state or local governmental entity in Tennessee. And so a little bit of the discussion in the Health Committee was about whether or not this was putting the cart before the horse, as there have been no attempts to require COVID vaccine at this time. Just as a little insight into the court's thinking under Jacobson v. Massachusetts, I often think that we discuss these issues as though they are only contemporary issues, only the issues that we're having now. But indeed, ever since immunizations were discovered at the turn of the 1800s, this has been a conversation that governments have been having with citizens. And we can see some insights here into that thinking. Justice John Marshall Harlan, who many of you may know was from Kentucky, actually delivered the decision in this case for a 7-2 majority. The Massachusetts law did not violate the 14th Amendment. In the opinion, the court held that, quote, in every well-ordered society charged with the duty of conserving the safety of its members, the rights of the individual in respect of his liberty may at times, under the pressure of great dangers, be subjected to such restraint to be enforced by reasonable regulations as the safety of the general public may demand. And further said, and that real liberty for all could not exist under the operation of a principle which recognizes the right of each individual person to use his own liberty, whether in respect of his person or his property, regardless of the injury that may be done to others. And so generally the court held that under the police powers, that the state had an interest in protecting the common good over individual liberty. Finally, I'd like to tell you a little bit about some Tennessee Pulse survey data that gives some insights into the public opinion around COVID-19 and some of the issues that are being discussed by the board and by the state legislature. The Tennessee Pulse survey is a cooperative effort of Tennessee Governor Bill Lee's Economic Recovery Group, the University of Tennessee's Howard H. Baker Jr. Center for Public Policy, and the university's Social Work Office of Research and Public Service. These surveys have been fielded every month, essentially, from May 2020 to February 2021. We've now collected more than 13,000 responses from Tennesseans on consumer sentiment and public opinion related to COVID-19 across 11 waves. So 10 waves are now publicly available on the Core 19 website. I've provided the link there, and we'll be posting the 11th wave from February very soon. So the data I'm going to be giving you is the wave 10 data. This is from the end of January, I'm sorry, and a total of 1,079 responses were collected for this particular wave. And this gives you the margin of errors. This is sort of the plus or minus how the confidence intervals. So 3% for the statewide sample, around 4% for the regional samples, and about 5% for those samples on African American respondents. If you actually go to the website, it is interactive. You can go to each wave and look at it yourself. You can also click on the tabs above here to see how this responses changed by different categories. And so this first question, if you had to choose which of the following two options do you think will have a more important impact on you and your family? And we see that 58% of Tennesseans who responded to the survey said that health impacts of COVID-19 were more important than economic impacts, 42%. This has dropped slightly from our wave in December, where people were much more concerned about the health impacts, but it is reflective of actually a change, I would say, in public opinion from when the pandemic first started, because these numbers were essentially 50-50 for many of the early months of the pandemic. So this has shifted to a greater concern over health at the moment. This is a question about mask wearing. What do you think is the main benefit of wearing a face covering? And 50%, you can see here, believe that it equally protects yourself and others, while the remaining 38% believe that it either protects others from germs you may be carrying or protecting you from germs carried by others. And there's only 9% of people that said that there was no benefit to wearing a mask. What sources do you trust about the benefits of face covering? So overwhelmingly, the CDC and health departments are the most trusted source of information regarding the benefits of wearing a face covering, 79%. And then across governments, state government, federal government, local government, they equally share levels of trust at around 30%. And then finally, employers and news media are the least trusted sources of the benefits of wearing a face covering. In terms of being supportive of a mask requirement in local communities, 78% overwhelmingly were supportive of a mask requirement in the community. Only 15% said no, so that's just over 1 in 10, and then 6% said they were not sure. If a vaccine that protected you from the coronavirus is available for free, would you definitely get it? 44% probably would get it, 20%, which indicates 64%, 6 in 10 Tennesseans are likely to get a vaccine when it's made available to them. And there's some uncertainty here in the middle. 1 in 10 probably wouldn't get the vaccine. And then we have 17%, so nearly 2 in 10 who definitely say they wouldn't get it. And so something to consider about the likelihood of people taking up the vaccine once it is made available to them. In terms of confidence in the safety of the recently approved coronavirus vaccine, this actually represents an increase in the confidence level. And so we have here that 50%, half of Tennesseans completely agree or agree that the coronavirus vaccine is safe, and 21% somewhat agree. So for the most part, we have 80%, more than 80% of people who think that the coronavirus vaccine is safe. There is an important smaller group of people who are displaying some vaccine hesitancy and even disagreement. Here you can see completely disagree, 1 in 10, and disagree 8%, which indicates about 2 in 10 Tennesseans disagree or completely disagree that it is safe. So in terms of who is the trusted source about the safety of the coronavirus vaccine, again, overwhelmingly the CDC and the health department is the trusted source. 73% of Tennesseans say that that's who they trust for information. This is followed by the state government, federal government, and then local government. The least trusted source is religious or spiritual leader. And then we have doctors and healthcare providers that about 50% of people say they think that's the most trusted source. And this was a select all that apply, so people could select more than one, which is why the percentages don't add to 100%. This is about models models that people trust. And so seeing or knowing that the following groups have been vaccinated would increase my confidence in the safety of the vaccine. So we can see here that if that people want to see their doctors and healthcare providers getting vaccinated. They say 75% say that 3 in 4 Tennesseans say that if their doctor or healthcare provider got the vaccine and they saw them do that, it would increase their confidence in its safety. That's followed by family and friends, and then elected officials. So people really want to see elected officials and family and friends also getting the vaccine. Those are important models of leadership for them in this arena. Allowing for standard exceptions, who do you think should be required? So this goes directly to the heart of that final piece of legislation that we were discussing. And so 48%, actually nearly half of Tennesseans, said that everybody should be required to get the coronavirus vaccine. And then this is different groups that they thought maybe should be required. So for example, public school students, college students, government employees, healthcare employees, service industry employees, other. And then there's about 30% say that they think that there should be no requirement. So some interest to take away there about people's willingness to accept a requirement for a vaccination. Those are all of the slides that I have for you. I'm happy to take questions. Thank you so much.
Thank you very much, Dr. Cahill. It's a great report. Any questions or comments on Dr. Cahill's report from board members this evening?
Thanks, Dr. Cahill. Dr. Gocher, sorry, if I may. So I don't know if it's a question or just a clarification. The ag bill, the agricultural bill, when we looked at that, one of our concerns is on occasion, not every year, but on occasion, and it's more frequent than it has been, we'll have an E. coli outbreak or other outbreak related to raw milk, which requires us to interact with that facility and at times stop their production. So would that be included in Regulate? Dr. Cahill, do you know?
So I want to preface this response by saying that I am not an attorney, but my understanding from the reading of the bill and watching the discussion about it in committee is that that is correct, that the county health department and the health board would not have any power to regulate any raw milk as long as it falls under an agricultural category for the state of Tennessee. So.
Okay.
Dr. Cahill, I have a question sort of as a follow-up to that. Is the agricultural restriction based strictly on the raw milk issue, or is it based on other things as well?
They didn't discuss a lot of the background for this, so it's hard to say for certain what was driving it. Most of the reporting around it, however, has been about the raw milk issue. To my knowledge, I don't know about any other issue. I think probably the raw milk is what prompted it. But because that has been not only sort of a hot button issue here in Tennessee, but also in other places in the country for a few years now. And so I think that that's what's prompted the legislation, yes.
Thank you for your response. Any other comments or questions for Dr. Cahill while she's here with us this evening?
Dr. Goetsch. Yes, go ahead. Go ahead.
I just have a really quick question. Thanks for coming, Katie, Dr. Cahill. Do you know how many of the other health boards have veterinarians on them? Raw milk is pretty near dear to veterinarians' hearts as a public health safety issue. So I find it a little bit distressing that our health department wouldn't be allowed to deal with raw milk outbreaks with various bacteria.
That is an excellent question. I am not aware of the makeup of other health departments regarding veterinarian. I do know, however, that the Tennessee code designates who should be on a county health board, and that a veterinarian is actually an exception category, not part of the standard category of inclusion on the health board. And so I can get that answer for you, but my guess is I think that I would imagine that it is unusual, perhaps, between the 4 county health boards to have access to a veterinarian who's able to serve on the board.
So a question about the first bill, and it really is not a question, it's just a clarification. And that is that it sounds like it's different when there is a state of emergency or when there is one declared in the county and when there's not. But if there is, if I understood, and maybe maybe I didn't, that the Board of Health becomes an advisory board to the mayor, but it also stated that the responsibilities of the public health officer or their duties do not change. And so that's where so the Board of Health is advising the mayor, but is that decision-making lie with the public health officer or lie with the mayor at that point?
So this is an area, I would say, of some ambiguity. So in the bill itself, it talks about it being advisory to the mayor. So I can read this. It says, if a county experiences a countywide health emergency, including without limitation, a statewide declaration of the existence of a health epidemic, a countywide epidemic, or an imminent threat of an epidemic resulting in the need for health policies that affect the entire county, the county mayor shall and has exclusive authority to establish and implement such policies under advisement from the county health director or county health officer, or both as necessary. In a county with a county board of health or a health committee or both, such bodies also become advisories to the county mayor. So that's the text of the bill as it was originally put on the General Assembly's on the General Assembly website. Since then, the bill has been amended, and you heard Representative Zachary talking about how the duties and responsibilities of the county health director would not be affected by it. And so my understanding from the current state of play is that the county health director their authority to make rules, regulations, and enforce said rules and regulations under the existing code would remain, and that the county health board would become advisory to the county mayor. And I think that the assumption there is that the county mayor and the county health director would work together. As Representative Zachary talked a lot about the accountability relationship between the county mayor and the county health director. And so, although I think there was a little bit of confusion there because about who the county health director is actually responsible to, because my understanding is that would be the state commissioner for health, not the county mayor. And so I think that there are some potential issues to work out that are leading to some confusion, but that's where the bill is at this point. Does that answer your question?
It does. Thank you.
Thank you. Any other comments or questions on Dr. Cahill's report?
This is Maria. I have a couple of questions.
Sure.
Thank you, Dr. Cahill, for your very informative presentation. Probably generated a lot more questions than I had before you presented. A couple of thoughts. One about the vaccination bill. This just may be rhetorical. I don't know. I'd like some insight perhaps from Dr. Buchanan. If we recognize in Tennessee that there already is a clause in which people can, for religious reasons, personal reasons, there's an exemption from vaccination. I don't understand the purpose of honing in specifically on the COVID vaccine if we already have that clause in place for people to not want to be vaccinated. And Dr. Cahill, you mentioned this maybe putting the cart before the horse, but I guess I would just like some clarity as to the ultimate purpose of this, where the goal.
So in discussion, and I'm happy obviously to let Dr. Buchanan also weigh in here. I'm sure she has much more familiarity with on the ground practice regarding immunizations in the state of Tennessee. But in the conversation regarding the bill sponsor, Representative Halsey, pointed out that part of the impetus for introducing the bill was the concern that an experimental bill or an experimental vaccination would be required for individuals to accept. And so that part of the amendment that was discussed quite at length, but was not ultimately passed, was about changing the language saying that until essentially the COVID-19 vaccine is fully approved for use and isn't under an emergency use authorization, that it would not be in any form required or, required either forcibly or coercively by the state. So you could imagine a situation in which, under in a continuing sort of emergency use authorization that, for example, school children are required to be immunized with the COVID-19 vaccine. And so the bill sponsor said that that was part of the impetus why he introduced the bill. I think some of the discussion was about the fact that, now we have millions of people in the United States who have been vaccinated with the COVID-19 vaccine and from its various distributors, and that there's quite a bit of evidence as to its safety. And so that perhaps the concern that arose in November when the bill was first introduced is no longer as robust of a concern. And I think that just kind of getting a sense of the discussion, I think that there is some hesitancy on the part of the state legislature to relinquish power or set precedent for relinquishing said power in this area, particularly when there are no current state or local laws or entities that are suggesting any sort of requirement.
Great, that does help a lot. Thank you. I have another question. Does anyone else have some questions? Yes, please.
Dr. Buchanan, on the topic of vaccinations. So first of all, understanding why this legislation was presented, obviously you need to talk to those who presented it. So I don't understand the motivation behind that. And Dr. Cahill did clarify some of that, but I think everybody needs to understand that we have never discussed or considered making COVID-19 vaccine required. There are vaccination recommendations and vaccine requirements for school, which actually come out of the Department of Education, not the Department of Health. And as you said, people have lots of ways to not get those vaccines fairly easily in our state. So again, we have no intention, nor have we even ever discussed on this board or at the health department making COVID-19 vaccine required.
Thanks everyone for comments. Any other comments for Dr. Cahill or any response to Dr. Buchanan's comment there?
This is Maria. I do have one other question about House Bill 7. I'm hoping you can help me understand if this is the normal process, and please forgive me for not being clear, but so part of the new language is that if I understand the process, the mayor declares a public health emergency, at which point we on the Board of Health will become an advisory body. So I have two questions. It's two parts. One, is that the typical process? Is it who usually? I guess I was under the impression that the public health officer is the person who declares a public health emergency, but I need education on that point. And the second part of the question is, does that mean the Board of Health, is that the only time we're advisory? It's the only time we advise, period, is just in a state of emergency once it's declared, or are we meeting regularly to be an advisory board in general to the public health officer? I guess I don't know if anyone else is confused as I am, but I'd like some clarity on those 2 points.
I will provide as much clarity as I am able to at this point. What I would say, based on, and if I may share again, my screen, let me see here. The difference in the text between the existing code and the revised code here, so we can just look at it a little bit more carefully. I hope you all can see that. So my understanding is that it is only in the case of an emergency that, and that public health emergency as determined by the county mayor. So this is an actual potential that the board would become advisory. In all other instances, the board, I think, would operate under its regular or its existing powers and duties, which including enforcing rules and regulations as prescribed by the commissioner. And so I think that it is only in the context in which there is some potential or actual emergency that public health related to public health that this would shift. And so I hope that answers your question. Now, as to I think something that is left unaddressed in the current legislation is this. Did you want me to leave that up? I can put it back up if you'd like, or that is left unaddressed is that It's a question about whether or not for example, the governor could declare a state of emergency, which I would imagine would supersede a county mayor's decision about an emergency. But there is some question about who gets to declare an emergency. So in the context of COVID, for example, if the governor declares a state of emergency, but the county mayor has not determined that such an emergency exists, there's some lack of clarity about whose jurisdiction would overwhelm in that case. I would imagine it would be the governor, but because the statute specifically says the county mayor is responsible for determining that emergency, that's an open question. So actually, if the county mayor in that case wanted to leave the power with the county health board, then they wouldn't declare a state of emergency. And if they wanted to take the power, they would declare a state of emergency. So it is a little bit opposite of what you might think. And so in terms of the other part of the question about the responsibility for who shall declare a state of emergency, the responsibilities for powers and authorities of the county health officer detailed in that same legislation. I'd have to go back and check and see if part of that power is for declaring emergencies. But I think that there are some significant overlaps in this legislation that will need to be worked out through discussion and probably some more amendment processes between the Senate and the House side, and to reconcile these issues.
Actually, I'm fairly certain under current legislation, the governor or the county mayor may declare a state of emergency. The health officer does not have the authority. The health officer has some authorities, or the health director does not have that authority, but would in that situation be advising the mayor regarding the current health situation.
Thank you for that clarification. Mayor Jacobs, I have a question for you. What is your opinion of this bill, House Bill 7? The Zachary bill.
I'm actually more confused now after hearing what Dr. Cagle had to say.
Mayor, if I can, I'm sorry.
Well, I mean, does the Board of Health have regulatory authority when there is no emergency, public health emergency?
That's how I understand the amended version to read. The original version that came out was much more broad in scope and made the health board essentially advisory to the mayor. But through the amendment process, it appears that has changed, and it's only in the context of an emergency that the health board becomes advisory. And I think you heard Representative Zachary talking about that it limited the scope to the context of an emergency. And it also removed the specific language about specific counties and designated essentially that any county that it now or in the future forms a health board, that would be a similar situation.
And it was also, maybe I'm wrong about this, but it's my understanding, well, if the governor declares an emergency, then that obviously is going to override. In fact, currently Knox County is not under state of emergency declared by myself. It's under the states. So the governor is operating under the executive order from the governor, in which case the confusion has come about as to whether the governor's executive order empowered the public health officer or the statute empowered the Board of Health. And I think this was supposed to clarify that. Also, when, the limits of the Board of Health's authority in non-emergency situations, all right? For instance, could the Board of Health just of their own accord, and I'm not saying you guys would do this, but, when you look at statutes, you have to consider the potential. Would a Board of Health just any old time say, gosh, we don't like this, we don't like sugary drinks, we're going to ban sugary drinks in Knox County? And that was I was under that assumption that it was the Board of Health was advisory in non-emergency situations. And then in emergency situations declared by the mayor, they remained advisory. The mayor would have final say so. But when it was declared by the governor, he can extend his authority to, the public health officer. But evidently that's not what it is now. in your reading?
In my, again, not an attorney, but in
Sure.
my reading and in Representative Zachary's own explanation of the bill, my understanding would be that the board would operate as previously authorized unless there was, unless the county mayor saw a potential or actual emergency, in which case the county mayor would make the decisions, ultimate decisions, and the board would become advisory. And that also the legislation does not affect the current powers and duties of the county health
officer.
So as it stands now, and that, yes, the powers of the board are detailed. I'm happy to provide a subsequent briefing on what those include. But they do have significant powers in this case, if this were to pass in non-emergency situations.
They're very broad, right? Outside of, right. So now, I'm actually, Dr. Hurd, I'm kind of with you. I don't know. This, I believe, is an attempt to clarify the statute, and it seems to, now I'm confused too.
Clear as mud, as I like
Yeah,
to tell
exactly.
my students.
And that sometimes it happens too. I would, you asked before what, the intent of whatever, and that sometimes it's hard with with any politician to determine what the intent is. And then when, these things come to the floor and all different amendments are added and the language is changed, then it becomes extremely difficult. I think Mr. Sanders would agree with me that the entire public health statute in the TCA is extremely convoluted and clear as mud. And that's why we've ended up kind of in this situation of, who has the decision over this and who has the decision over that and what circumstances. And I think this was an attempt to somewhat clarify that, but I don't know that it does. So, Mr. Sanders, would you like to opine on that?
So if I can get the waters one more time, I have a hypothetical question, which I don't think is really that hypothetical, where you might have not a true emergency throughout the county, but you might have, for example, an outbreak of influenza or norovirus that would be in a nursing home or a series of nursing homes that might require protective quarantine. And how would that be handled under the new law? So Dr. Buchanan, Dr. Cahill, Mayor Jacobs, how would that be handled?
Probably best to ask Mr. Sanders on that if you do have an opinion.
Mr. Sanders.
Wow. Let me first address the mayor's earlier question. He and I had a discussion after one of the meetings about how convoluted some of this statute was. I will agree that the public health statutes related to these issues are difficult to get through. And I commend Dr. Cahill on her efforts here to straighten them out. I appreciate it very much, and I'm sure everybody here does as well. As I had told Dr. Buchanan earlier in a private correspondence, I prefer to opine on legislation as it exists, not really get involved in what is, essentially at this point, a hypothetical question. This cake is half baked right now, in any sense of the term you want to take. We don't know what's going to come out of this. Majority of these statutes are the big statute here that we're talking about, proposed statute, is in front of a Senate committee. The Senate's going to have a different take on this than the House does. I prefer to wait until we see what's actually comes out of this, if anything, and render any opinions then. Last time I tried to render an opinion about it, I found out that the language of the proposal had been changed that very day before I had even, and I was rendering an opinion on something that didn't even exist anymore. So I'd really prefer to wait until we see what's actually gets signed.
I think that that's I think that that's wise. It is changing quite rapidly as this sort of moves through the discussions. It is hard to say exactly where the legislation is going to land, and also some of these open questions. And so I think it's difficult to address hypothetical situations per se. What I will say, however, is that this tension between what the police powers of public health that have been enshrined in law for quite some time in the United States, and sort of individual liberty and unelected versus elected accountability and how that operates these aren't new discussions. I think what has happened is all of this, the existing power that was otherwise sort of under the radar for both the public and elected officials and even bureaucrats themselves, has come to the fore because of the pandemic. And so now we're struggling with these questions of, under what rules do we want to operate and what do we think is reasonable? So, in the context of COVID, people might have one opinion about who they want to be responsible in the context of, a measles outbreak, right? Which could be in its own considered potentially a public health emergency, but they may feel very differently about that. And again, they may also feel differently about something like an Ebola outbreak, right? About who they want to be making decisions in that context and how powerful they want those individuals to be in terms of enforcing or regulating any sort of behavior or activities. And so I think what we're now struggling with is trying to come to a new equilibrium now that we have reached sort of this awareness of how much tension there is really underlying between public health statutes and democracy and the democratic process.
And if I could add to that, it's also been the length of time that this has gone on, which is unique in emergencies. And we've all talked about this. You have a natural disaster, and it's here and it's gone, and you deal with the aftermath for some time. But in other emergencies, this is a much longer time horizon than that has been, and that's a struggle too. Is who has this power for this long, and all those sort of things. So, but I think you're exactly right, Dr. Cahill.
Any other comments this evening on this topic? I think it's been a good discussion. Any questions, comments from board members? If not, Dr. Cahill, thank you very much. It was really enlightening, and we want to have the opportunity to bring you back when things continue to unfold, if that's okay.
Yes, please do. I'm always happy to come and speak to you, and I hope it was informative. I'll be sure that the slides are shared so that they can be posted as is required.
Okay, great. Thanks again. So next on our agenda is an update on Governor Lee's executive order, and is this going to be from Mr. Sanders or going to be from Dr. Buchanan? Or Dr. Buchanan is waving her hand. Dr. Buchanan, you have the floor.
No, just to clarify, the executive order was extended, allowing for virtual meetings until April 28th, which means our meeting in April will be virtual. We've reserved places. We've reserved a room in the city county building if we need a meeting space for May and I believe June as well. But I also wanted to take a moment to clarify with everybody. My understanding is that this is now our monthly meeting. The whatever Wednesday of the month this is going forward will be when we meet, unless we decide to meet more frequently. So the third, is it the third? Okay, just to make sure. I was a little confused. So we're all on the same page. But there's a potential that in May we'll have to meet in person. It totally depends on the governor, what he does. So that was it, just to clarify that.
Okay, thank you. Any questions from the board on that? So we will be meeting, if our schedules are all correct, 4 weeks from today then for our next, and we'll get the dates and everything for that. Okay. So the next item is in our amended agenda, the discussion of Board of Health escalation and recession metrics, and that's kind of been blended in with item 14. And Dr. Shamia, are you taking the lead on this one for us?
I was the one who proposed the blended piece, and so I'm not sure who put the other piece on the agenda. I mean, I'm happy to start the discussion. Dr. Buchanan, did you say?
So maybe we should, you guys want to start with reviewing the data. We have our data as it relates to the metrics that we put, or the escalation and de-escalation metrics we put in place.
I think that's great.
Here we go. And now we're sharing that. So are we good? Yep. Okay, there we go. So go ahead to the next slide, please, Jerry. So this is just a review. Our positivity rate, our recession barrier was less than 5%. Our escalation barrier was greater than 10%. We've certainly been above that for a while. For new cases, 5 new cases per 100,000 over 28 days. I'm sorry, and all of these are over 28 days. And then for escalation, 10 new cases per 100,000 over 28 days. So if we look at those trends currently, here's the positivity rate. And as you can see, we are trending close to our escalation barrier. With this, we're down about, I don't know what the actual number is.
It was
today. But,
I got it. Hold on. I didn't do my homework.
So we are, we're approaching the escalation barrier. And we talked about, somewhere in between those two would be when we start changing things and decreasing regulations, the few that we actually have in place.
I think it was 9.86. It was 7.86 on Monday, and I think it was 9 today. So we're just kind of hovering right in there.
Okay.
This is Charity at the Health Department. Sorry.
So if you want to show us the next one, Charity, this is cases per 100,000, new cases per 100,000 over 28 days. So again, we're really close to that escalation barrier of 10 new cases per 100,000 over the last 28 days. So that's an estimate of 47 cases a day, and right now we're right at 50 something cases a day. So we're right there at our not at our recession barrier, but at the escalation barriers. Anybody have any questions about that data before she stops sharing it?
So just a question about terms. My perception of the escalation barrier is that you are, say, 5 or 6 or 8%, and all of a sudden there's a surge and you go above 10, and that creates an escalation in restrictions. And if you hit 5%, then that is a clear signal to start de-escalating restrictions. So what if you're between 5 and 10? You're on the way.
Right. So that's for us to decide, to be honest, Dr. Goetcher. We talked in the past about, in that middle zone, would we, if we had regulations in place, would we start to peel some of those back, knowing that things like the mask mandate are going to be one of the last things to peel back. And for us, that's not a lot. We have 3 regulations in place. So, I think it's time to talk about that. Again, we certainly don't have a crystal ball. We're hopeful that more people will get vaccinated and we'll be able to actually achieve herd immunity through vaccination and have some level of protection for everyone who desires to be vaccinated and others who don't get vaccinated because more people are vaccinated. And our cases will sit at this plateau and then maybe go down a little bit, maybe use the weight loss analogy again, because sometimes you plateau and then you start to go down again. So we're hopeful that we'll see those continue to go down. I think the plateau is a little concerning because I can concern that we'll plateau and not go down, but go up again. So that's just, where we are. We've seen other places take things down and reduce regulations, but that's been very recent. Remember that it's a 28-day incubation period. So people have to get exposed or not 28 days, sorry, 14-day incubation period. So people have to get exposed and then they have to get sick and then we have to get sick enough to test and know that they're a case. So it takes a while for us to see the effects of those loosened regulations in other places. And so, that's just kind of where we are. I think we as a board we have some difficult decisions to make. Dr. Shami, I don't know what you wanted to add to that.
So kind of first, a few things just about the little piece I was going to put on the agenda, which is how I see things over the next little bit. And then I'll make some specific comments related to some of the statistics. So I do think the next several weeks are going to tell us something in that, I mean, what we're hearing about is the UK variant and its transmissibility, and then whether or not that everything is saying that that's going to become the dominant variant in the community in just the coming weeks, and then our vaccination rate. And then we also have spring break. And, that's the first real event that we've had, I would say, since the December holidays, maybe the Super Bowl, arguably, and we didn't really see anything out of the Super Bowl. So there are a few things kind of happening all at once that will tell the tale over the next several weeks. So now that I'm not saying that should impact whether we do or don't have anything related to recession barrier or repeal anything, but we are in this period where some new things are in our environment. One thing I would say about the metrics is that if I had to choose was I going to put more emphasis on cases per 100,000 or positivity rate, I would probably be more looking at cases per 100,000. The reason I say that is we know positivity rate is so based on the amount of testing we're doing. And trying to drive up testing early in the pandemic was truly a public health measure. It's contact tracing, it's control. In a partially immune, partially vaccinated population, there's just no reason to expect that we're ever going to see the same kind of testing. And we may not need the same level of testing that we saw before. And so I just don't honestly know if positivity rate is just going to linger in a certain place and not drop, or if it will. But I would expect the cases per 100,000. There's no reason why that shouldn't continue to drop if we're continuing to see fewer cases. Now, we never said we were going to just absolutely be super rigid with the recession anyway. We said that was going to be a guide and not an absolute. But I'm just telling you that I would rather focus on cases per 100,000. My final comment is that we're in this part of the pandemic where, and a comment was made earlier about the hospitals, and they are, without question, the hospitals are in a different situation than they were. But there's also going to be, we have to remember that at the level of the individual person, COVID hasn't changed. And so if any particular person 4 months ago was going to get COVID and end up in the ICU, or was going to get COVID and die from it, that hasn't changed. If they get COVID, there's still that same spectrum of possible outcomes as before. But from a population, it's different. I mean, we're definitely in a different place from a population. And so I think that's just word to the public is it's kind of like the last person to get polio before the vaccine was authorized. We're just so close that I mean, part of some of the mitigation, whether it's by choice or by policy, is that if you get COVID, then your likelihood of X, Y, or Z happening isn't no different than it was when we were absolutely at the peak. And I don't want that to get lost, because we have such a tendency to talk about the population that we forget about the individual person sometimes.
Any other comments or questions from the board about sort of our metrics and blended into where do we go from here?
So the only other thing I'll add to that is, when we look at other infectious diseases that we manage and that we work with organizations to control, we want, and I've said this before, we want 2 full incubation periods with no new cases. I realize that is an impossible thing for us to strive for in the case of COVID. But if we look at the data, we have been trending down. Now we've kind of plateaued off. And so I do think we need to wait and see if our trends go down again or if they escalate. I think time will tell. It won't be long. We'll be able to see that before we consider changing much. Again, we only have 3 regulations. We have a mask regulation, we have a gathering size regulation, and we have the restaurant regulation. So we only have 3 things on the books. So anyway, those are my other 2 cents.
Other comments, questions? From board members? This will be the information we're going to carry forward as we go into item. Well, I guess it's still 17, I guess.
So I really probably carry through all the items that remain. And so Dr. Buchanan, the one thing that I would say between the 28 days and whatever an absolute cutoff is, and I'll just focus on cases per 100,000 since that's the one I mentioned, is that I do think there's a give and take to some extent between where we say we're at what level, 9%, 7%, comfortable doing something in the 28 days. Because one thing we're hearing is in this economic environment, 28 days is a long time. And so while I certainly understand the science behind not only getting to a certain threshold, but staying there for a certain period of time, I do think at some level it may be difficult to, because I mean, in the midst of that 28 days, we'll also know, are we continuing to drop? Did we plateau or did we start to creep back up? And so I don't know that that's going to be, that may become increasingly difficult to do, is my point.
So Dr. Shamil, let me give you a hypothetical. Let's say that we do away with some or all regulations as a result of our positivity rate being below 10% today. And let's say that it creeps up to 11 or 12 over the next month. What would your course of action be? To reinstitute?
Well, first of all, I don't know that I would be doing that based on the positivity rate for the reasons that we just described. But let's make it even more hypothetical. We get to some number that we are comfortable removing regulations, restrictions, and then we see enough of a spike that appears to be a lasting spike that is over 10%, because I think our escalation barrier doesn't change in this environment, then from a public health scientific perspective, then yeah, you could say you would add back whatever was the last thing that you took away. I mean, that would be kind of the way. I think the reality you have to consider is that that's not going to be, it wasn't easy to do the first time. And I don't necessarily think it's going to be any more straightforward to do the next time, regardless in whose hands it's in to do it.
So as we face these questions this evening and down the line, I think as a general statement, everybody wants this to end. They want it to end as soon as possible. It's not the biologic behavior of this virus, but we would all like this to end. If we guess correctly and we loosen mitigation strategies and the rate goes down, that will have had a great social and economic impact, as well as not affecting viral transmission. If that's not the case, we would be obligated to reinstitute stuff, and it would be difficult from a social and financial standpoint to do that, but it might be necessary. So we're trying to guess the future. It's really difficult to do, but loosening things up, if it continues to go down, is a winning strategy, but we don't know the future. Questions, comments?
Well, that Dr. Gocher, to follow up on that, I mean, we're still in a position, we've always had the posture of doing things gradually. And so, you know, that is one of the factors that gives us some flexibility in what you've just said, is that if we can, there have been some loosening of things, and if that continues, what I don't think is going to happen, although again, I'm trying to predict the future too, is that we're just going to get hit out of nowhere massively over 2 weeks. Now that could happen with the variants and whatnot, but you know, I think we will see something coming to some extent. And so, you know, that's philosophical then. Do you just do what some places have done and just say, okay, we're done, it's all gone? Or do you continue to take the approach we have, which is based on data, you gradually lighten up on things? I think Dr. Buchanan's point is well taken, and that's true both on hospitalizations and on cases, as we're seeing a little bit more of a plateau as opposed to a continued drop. And so I mean, ultimately, as so many things we've dealt with, I'm not sure there is going to be, and you know, somebody can say there's an absolute right answer to this approach. We're kind of riding this, you know, we're living through this as we have before.
So Dr. Shimi, another question for you, or Dr. Buchanan. Has there been any significant penetration of variants in East Tennessee at this point, or are they strictly not in our community? Do you know?
You ready?
Yeah. I'm trying to start my video, but it's not going. There we go. So I can chime in a little bit. That's a relatively difficult question to answer right now with the way that the genotyping occurs. So there's a project happening, Tennessee's participating in with CDC, that automatically a certain portion of tests are sent to CDC for genotyping. By far, the main variants that are being seen across the state is the UK variant. The other side of that is there's also times that submissions are made if we, for instance, have what could be a potential breakthrough vaccine case. It's somebody that's fully vaccinated, 2 weeks post-vaccine, and then they test positive. The state is asking us to attempt to get those specimens to CDC for genotyping as well. And sometimes we can do that, and sometimes we can't. So I guess there's not probably as much typing as a lot of people would think that's happening right now, just to be completely straightforward about that. But what we are seeing across the state, and I can't tell you right now how much is in East Tennessee versus the rest, but is the by far dominant variant that is seen is the UK variant. And there's more and more. So it went from, you know, a relatively small number and then exponentially greater the next time that we were able to look at that data from the state and see it. So it is growing, but there's just not as much, you know, typing that's occurring to be able to have a really good handle on what we're seeing. But by far, I think the trends and what we're hearing to expect is what Dr. Shamiya said already, is that the expectation is that it will be the dominant strain very soon, if it is not already in our area.
And I know this is probably also preliminary, but at least according to what information I've been able to see in the literature and in the press, the UK variant seems to still be susceptible to at least Pfizer and Moderna. We don't know about Johnson & Johnson, but at least Pfizer and Moderna work on it successfully.
That's everything I'm hearing.
Yeah.
Yeah. And Dr. Gocher, one additional point is that I think what we've seen happen in Italy, if you recall, Italy was what got everybody's attention, even more so than in China. And so they've got the variant, they've gone partially back into lockdown. But the big variable, and this is the unknown, the big variable is we've vaccinated much better, if I understand correctly, than they've been able to do. And so it's not, I guess what that shows is it's not impossible to get back into trouble. I mean, they've got a lot of people who've had COVID in Italy. I mean, just like the entire world does. So there is some level of background immunity, yet they've still run into trouble. So it can happen. The difference is that we, without question, have had more success with our immunization program. At least I think that's true, Dr. Buchanan and Charity. I don't know if you know, but that's what we're really going to be depending on as much as anything right now.
Yeah, I can't speak to their vaccination program, but I can say, to echo what you're saying is the way that it's been described from different folks is we're absolutely in a race between vaccination and the variant spreading, and can't let up on that vaccine piece because the more vaccine that we get in the community, the less opportunity to spread is, and that negates the variant concern, right? And so there's less point of contact when that's happening. And so I think that goes with the message of what you're saying and what they're seeing, which is why in Italy they've rolled back some restrictions and all of those things because the variant was outpacing the vaccine.
Dr. Gocher, could I ask a question and make a comment?
Sure.
Well, actually, I'll make the comment first. One of the things that we did as a group is we established the Tennessee Pledge as our foundation for the community, and then built on top of that these regulations. So if we make any changes, I would think today or in the near future, we still at this point would have the Tennessee Pledge and what it entails as our foundation for the community. So yes, we could take down a public health regulation, but we will still have those things that the governor has enumerated for restaurants, events, swimming pools, et cetera, still in place. So I wanted just to bring that up as we continue this discussion, as we get into the specifics of each of these regulations. The other thing that I will just give as some information is I decided to check on the sewage viral load data that UT has had. And as of this week, it has substantially decreased and does not show any bumps recently. So it's down at a very small level at this point, which was very good news for me to receive. That was something that I wanted to follow and to see. We've got the whole campus being watched and evaluated, and they've been sending off specimens, and they have reported to me that has gone down substantially. It's at a very minimal level at this point. So about 30,000 people on campus, the sewers being tested, and that's where they're at. It's just a microcosm possibly of our community. So I want people to know that, and that's a very good positive that we have going on right now.
Thanks, Dr. O'Brien. Dr. O'Brien, do you have at your fingertips information on specifics on the Tennessee Pledge regarding how it would interface with our regulations? Or a lot of the Tennessee pledges are suggestions rather than mandates.
Well,
that's what it is. It's there's not so many shalls in the Tennessee Pledge. It's giving suggestions of how to operate. There are a few. I don't have it right in front of me, but we use that. It talks about the distancing within facilities. It talks about all those things, but it's not of a regulatory nature. It is of a recommended nature. And, it's one of those things that I find in general when I go in the community that even though we have what we have stated, I think most people are still following that. Some follow it better than others. But it is not a you must in every case.
Actually, it is really just a guideline and recommendations. There's no regulatory piece to it. The governor's been very clear about that. It provides all the same guidelines, distancing, recommends mask wearing, sanitation, and all the things that we've been recommending.
Comments from the board, any further discussion on this topic? If not, really appreciate the good discussion again. Our next agenda item is discussion of guidelines for caterers and event venues. And we have heard both through email and we've heard in the public forum two speakers in public forum giving us input on this. So we can open the floor from discussion from any of us that want to start the discussion in this regard.
Well, so I guess I'll go first. I'm not sure if anyone has any sort of regulation in mind that they've written up and we just haven't seen yet, but thinking about how these events happen, and a lot of them are not actually that different than how restaurants operate. I don't think it's unreasonable to think about, limiting, if we're going to continue limiting how many people are in a space, be it a restaurant or an event venue, then I don't think that it's unreasonable to look at those in the same manner.
I will tell you for our department here at UT that we had a graduation banquet last year that was catered, and we had regulations that the caterers plus the guest had to equal 50 back in that time, and everything was adhered to just perfectly. And this was done without things being codified, and I don't know whether it was actually legal or not. I assume it was. Worked out well. And I think that's what possibly our input has been, is to maybe codify it so that people can proceed with their catering business and associated businesses. That's my take on it. But I think it's been done on and off in the community, at least to some degree.
So, Dr. Gocher, I went back and reviewed our gathering size, really, read it again word for word. And this is kind of the difference between what is really written and what is perhaps messaged and understood. But if we have 10 people and 360 square feet, then if you have twice that many square feet, my thought was always that you could have more people and so on. And so I guess that's one point that as I thought through this and the feedback we received is that I don't know that it's been explicitly said that people cannot have these events. I think what's been interpreted is the 10 people. And there was a period of time where that's the message that needed to be sent and the message that needed to be received. But the wording and what has been a regulation hasn't, at least, and you guys please correct me, because I may not be perfect in my reread, but I don't think it's explicitly restricted those types of gatherings, but I understand why they haven't happened. And then the other point I would make is that irrespective of how this conversation goes, one thing that some people would like to have is kind of a guarantee, meaning that I want to be able to plan something 2 months, 2.5 months down the road and know that I'm not going to lose any money, or know that, all those types of things. And clearly we're not in a position, just based on the discussion we've gone through, where we can provide that. So even if there is either clarification of regulation, or even if we go down the road of what they're asking, which is a percentage occupancy, what we can't do is just be able to say the pandemic is over and we fully endorse these things, because as we've said, we just don't know what's going to happen in the coming weeks for all these reasons we've already stated. So I'm not fundamentally opposed to, I agree, there's a lot of the same issues that go on in restaurants, but I just also don't know that the regulation as it was written fundamentally prohibited these types of activities, but I understand how it was interpreted as such.
And I guess I would add to that, when I look at our restaurant occupancy limitation and early closure regulation, we kind of broadly define it's all restaurants, bars, and similar food and drink establishments, including nightclubs, will limit their capacity to 50% capacity, and limit seating. And yeah, the social gathering limitation has a square footage limitation to it, but I should have asked this while they were on it. I'm just not clear on what about the regulations is being interpreted as limiting what they can do as event planners. Funerals and weddings we can't do anything about those per the governor, but I didn't ask that when we had them on the meeting, and I don't know if anybody's talked to folks in the event industry and knows an answer to that.
So I spoke to someone, and I think there is just this level of misunderstanding, and hence the desire to have something as clean as 50%. Because if you have a building that can have a certain fire code occupancy, and you just say that you can have half as many people in it, not only is that understandable, but I'll say this too, is that I get that part. It's clear. But what it also implies is, I think where you have to be careful is it does carry with it a little bit of an endorsement that's okay. And so, if the place holds 1,000, then we're saying 500 is okay right now. And so that's the tension perhaps in going with a percentage. But it was wanting clear messaging when I spoke to the person.
I also spoke to somebody and they specified the social gathering regulation and how the message is nothing. Some event organizers are interpreting that as nothing can be organized at all for more than 10 people.
Ms. Roma, in your conversations, did they offer any suggestions as to how to remedy this, or what they would like to have other than, wide open maybe? Those public speakers didn't seem to indicate they wanted it wide open this evening. That was my interpretation.
In line with what Dr. Shamia was saying, something, they want to be treated as restaurants or some type of specification. I mean, what they would really prefer would be, to be trusted to follow the Tennessee Pledge. But at the very least, it's the social gathering that seems to be harmful, and they would like to be examined, to be considered to be in line with restaurants.
I got the same message too. I think basically that the business community would really like to fall back on the Tennessee Pledge recommendations and to live that way and to show that they could. That's the conversations I've had in the last week.
I think the thing I would say is that events are not going to eat at a restaurant. Otherwise, why would we have event centers if it's just going to eat at a restaurant? You go to an event center to mingle and see people, and not to sit at the same table and not talk to anybody else. So events are different than restaurants, very different. And we talked about that before, how the purpose, intent, and intention of an event is different than the intention of going to eat at a restaurant. So that does set them apart. I mean, if this board wishes to write something that is more clear, that's certainly the privilege of this board, but I think we have to remember that events are not the same as going out to eat at a restaurant.
Dr. Buchanan, I don't know if that's necessarily true, because many of the events that I've been to have basically been, sit down meals with speakers or various things. So, I mean, in some cases it probably is, but, I think in this environment, they realize that, large number of people mingling is, something that they would probably not want. So I think that following the same guidelines as restaurants would be a good compromise.
To tag on to that, the person that with me and someone might have mentioned apology in the public forum as well, but a willingness to have seating charts and take temperatures, which we don't do in restaurants. So, I mean, to me, that's an added layer of protection in terms of contact tracing.
But
I think that
also-
shows more than a willingness to be given at least the same opportunity as restaurants to function, get up and operate.
Sorry, Dr. Hurt. In addition to that, with events with the seating chart and so on, you typically have the contact information for everybody who attends. And so contact tracing
Exactly.
can potentially be done with a little bit more ease than with a restaurant.
I just don't know at this point in the pandemic how much aggressive contact tracing is going to happen even with that information available. I have a hard time thinking that, I mean, yeah, the fact that they would potentially do that makes us feel better. We're treating ourselves at that point, but I'm not sure that necessarily would be a real public health measure.
I mean, we are doing some limited contact tracing, not as aggressively as we were in the past. With our case counts being lower, we have reinstituted contact tracing light. That'd be fair. It would give the venue or the event organizer the ability to reach out and tell people what happened, which we do regularly with events. When we have a foodborne outbreak, the event organizer or the venue helps us find people to inform them, not for the same reasons necessarily, but for awareness if they were to get sick. So that already happens. So they do that regularly to help us out.
Okay. Yeah, I didn't have that context. That's helpful.
Other comments? Dr. Hurd, I sense that you were ready to speak. Did you have any other comments? Okay.
Just agreeing.
Got it.
Can I ask a quick question? This is for Mr. Sanders. How, and I know I don't know if it's easy or not, but to essentially add these type venues into the current regulation that includes restaurants and bars, is that something that's doable or no?
I had not before this meeting taken a look at that. My suspicion is it is doable. It is not going to be easy because you have several different regulations in place, and it depends on what you want to several. You have 3 different regulations we're trying to balance here, and I guess 2 if you just got the mask mandate, the social gathering and the restaurant occupancy. So if you are, it depends on what you're trying to do here, essentially. And I'm not sure I've heard enough yet to understand what a proposal would be. You can amend any of your regulations. Typically, what we've done is gone to simply writing a new regulation in this new year with new language. But as far as the basic mechanics of it, how difficult is it going to be? Well, it depends on what you want to do. And since I don't know yet what you want to do, I can't really say. You'd probably have to, based on the conversation I'm hearing so far, my suspicion is you would have to rewrite both regulations, the occupancy and the social gathering one, to effectuate the purposes that you want.
Mr. Sanders, do you feel that the 2 regulations as they're written, I guess really the restaurant one doesn't apply, the social gathering does apply, but for the reasons I mentioned earlier about square footage, do they in and of themselves prohibit these events from occurring as written?
There's a lot there. Let me unwind that a little. First of all, I don't think that the gathering limit regulation, as I see it, prohibits a certain number of people within a certain designated square footage. So if you have a venue hall with much larger square footage and you space people out appropriately, then a larger gathering is not strictly prohibited. You just can't have more than, 10 people and 360 square feet. So you have a venue that's, 3,600 square feet, presumably you'd be able to have 100 people in there. I mean, that's just rough math. I'm not an expert in geometry. So if it works out to more than that, don't hold it against me. So I think you can have more people than just 10 people. There's not a specific prohibition, as I read the regulation, on having any more than 10 people. But as the mayor pointed out earlier in his discussion about going back to the restaurant for a minute, some of these events are held in restaurants, or at least I gather that was an implication of what he was saying. Some of these events are in fact held in restaurants, and in that case, the restaurant occupancy limit does have an influence. So I think you would have to rewrite both of these regulations in order to get that. And it depends on what you want to do. You're looking right now, your social gathering regulation is essentially written to keep people 6 feet apart. That's the idea. It's 10 people and 360 square feet, 1 person per 36 square feet. That is each person in a 6-foot bubble, essentially. Obviously, you can write your regulation to do whatever you want. I am not the policymaker here, but I'm not sure the practicality of telling an event coordinator that they can't have an event that has any more than has people spaced out 6 feet apart all throughout. That's pretty dispersed population for most events that I'm familiar with. Did I answer your question, or?
You did, yes.
So if the stated intent from our speakers and folks that we've heard from on email is to be on a parity with restaurants as caterers, how could we accomplish that? What do we have to do to accomplish that if we feel it's a reasonable goal?
Are you asking me specifically, or are you
anyone on the board, or Mr. Sanders, to you specifically about crafting this? If we have a general intention, I sense that we do. I don't know. We'd need to probably take that to a vote. But if the intent is to equalize this as with restaurants, and we have the other social gathering limitation regulation to deal with, how's this crafted? How could it be affected?
I think, Dr. Goetcher, this is not going to be a popular opinion, but I think what you're going to have to do is you can come up with some ideas, but you're not going to be able just to say in general terms, this is what we want to do, and we're going to vote on it, and that's going to be our regulation. You need to vote on something that's specific.
It has to be precise. Exactly.
Yes. So I think what you're going to have to do is you can give an idea. You can talk about this idea all along, but you're going to have to come back to the table at your next meeting with a specific regulation you want to vote on. I'll be glad to help anybody work on that. But I don't think you're just going to be able to come up with vague ideas tonight and somehow craft that into a regulation that nobody's actually even read sort of retroactively. You're going to need to vote on something, and that something isn't ready tonight.
As a board member, I might even appreciate more specific input from folks that are involved in event planning and event execution and catering, to see specifically how being on a parity with restaurants would work for them. I think we've gotten some favorable information, but for me, I still have some questions about how to craft a regulation or how to amend our present regulations. How about board members? What's y'all's thoughts on this?
This is Diana. I'm wondering, what do the event people want? Are they wanting, I know that some of the banquet halls and stuff are still doing events, but they're spaced out and they're limiting the number of the people in the room. So exactly what are they wanting? Do you know?
I think what we've heard is parity with restaurants, but I don't understand exactly specifically what that means in terms of catering. I don't. I understand the concept, but I don't understand the specifics.
So I'm going to infer just based on one of the conversations that I had, and that is that when we said that when we have a regulation that says you can go to a restaurant that has 50% occupancy, that has no more, that has a single household, 8 people, it really was sending a message that we thought that was okay. And I think that for those businesses that are struggling to some extent, by having something equally specific, they're hoping that it will send a similar message. And so the other thing, Dr. Gocher, just in terms of the order that we're discussing this, is that I guess hypothetically, if the gathering size regulation does not get extended tonight, then I'm thinking that simplifies a lot of this conversation, because I do think that's what a lot of the perceived restriction is, even though maybe it's not absolutely written, that's the perception. And I'm not saying that that's going to happen, but it almost might be worthwhile to circle back around to this after we get through the rest of the, knowing full well, Mr. Sanders, I agree with him that we're not going to be able to write a regulation tonight, but at least to circle back and see where we land, just to determine next steps on this conversation.
May I, Dr. Gocher?
Yes, please, go ahead.
Okay, so I have a motion. I have a motion that we let the social gathering limitation expire as it's written. And then we edit 2021-2. Yeah, Charity's gonna pull it up. Amend, edit, whatever we want to call it. Maybe Charity's gonna pull it up. There we go. And scroll down to page 3, please. All right, in A and B, and there probably are other places where we'd have to add this, but all restaurants, bars, event venues, and similar food and drink establishments, blah, 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 in A. B, all restaurants, bars, event venues, and similar food and drink establishments, so and so and so and so forth. I'd have to read it. I think that captures the 2 places that is said in this. There's another place, the intent of this regulation, on page 5, we'd have to add it there, but everywhere where we say restaurants, bars, and similar food establishments, if we inserted event venues in there, then they have their 50% guidance. They still need to close at midnight. But would that be amenable to this body?
I think that's kind of what I was trying to ask Mr. Sanders earlier, is could we insert something in there into this one already existing document?
So in order to discuss this, Dr. Buchanan, will you offer that as a motion and we'll get a second and then we can discuss it?
I did. It was a motion.
Oh, we have a motion. Is there a second?
I'll second.
We have a motion and a second. So further discussion on amending 2021-2 as described by Dr. Buchanan. Thoughts, discussion?
Well, so again, this was brought up, so we would drop the one regulation and then just go to this one. Now, something that has come up also in my discussions with business people is that what we're just talking about right here, the 12 p.m. at this point, and there have been requests, could we go to the Tennessee Pledge for that from businesses in the community, that by dropping not only the one but the other, they would ask our consideration tonight. And I've had input from people strongly wanting us to consider allowing them to do business following the Tennessee Pledge, but not having the regulation hanging over their head. So I wanted to bring that up because that is out there, and we need to talk about all of it tonight.
I would caution us. I would say we need to do this in a stepwise fashion.
I agree. It's the question is it one step or two? And we do need to. I don't think personally the mask mandate, I think, is something that we need to continue at this point. We're not there yet, but these other two, I think we do need to discuss and try to come up with how far to go. So I think we just need to understand there's a lot of concern in the business community that we're holding on to regulation for the sake of holding on to regulation. And they keep bringing up what Nashville's doing, their new regulation as of this week. What else is going on? You know, so again, this is assuming though that the Tennessee Pledge is their foundation and that they would, again, pledge to follow that.
So Dr. O'Brien, if we're talking about closure times, does the Tennessee Pledge directly address that or not?
No, the Tennessee Pledge has no occupancy limits, nor does it have any closure. Again, it's not a regulation at all.
It's not a regulation. It is recommendation, 6 feet spacing, those sorts of things. It is not a regulation.
But without any occupancy limits or closures or any of that stuff.
That's true.
So Dr. O'Brien, do you have knowledge of how Davidson County is handling this or changing this regarding specifically closing times?
2 a.m. is the new one.
So they have not gone by the Tennessee Pledge, which would make it 3, 4, whatever, but they've come up with 2.
That's the newest one that the Metro Health Board and the mayor put in place. They just
I don't see a time limit in the regs for restaurants in the Tennessee Pledge. I could be overlooking it, but
there is none. There is none. No.
Yeah.
I agree. I'm just bringing to everybody. We need to discuss what the public is asking and what we're talking about, and where we need to go. We have the balance of relatively good numbers. We have business concerns where people are asking our help. And so we've got to balance that. Again, Nashville went from midnight to 2 a.m. just in the last week. So that's just something I want to bring up for us to talk about.
And throughout this, Nashville, it's tended to be much more strict than we have here in Knox County. What is Hamilton County doing? Dr. O'Brien, do you have any idea on that one?
I didn't see any time on anything down there is what I.
They have a mask mandate.
They have mask mandate, that's it.
Yeah. They just have masks and they do the Tennessee Pledge, is all I understand.
So right now we are discussing or debating 2021-2 amended to include catering enterprises. We have not advanced any more amendments to 2021. Dr. O'Brien, are you wanting to entertain an additional amendment, or maybe Mr. Sanders, you can guide us through that from a parliamentary standpoint?
Sorry, it took me a second to find my button. I think that Dr. O'Brien would need to offer this as an amendment if this is what he wants to do. As long as I have your all's attention for a second, I think that you also, if you're going to go with Dr. Buchanan's suggestion and alter this alter the language in sections 2A and 2B of this regulation. You probably need to do this, reflect the same change in section 2C. But also, and finally, I would say that as has been your practice, this regulation actually expires tomorrow anyway. As has been your practice, I think the better thing to do is, although you're talking about amending this, is to actually make this a new regulation if you choose to go this way, and just simply allow 2021-2 to expire and make a new regulation in its place with the same language, with the exceptions of whatever you all vote on, 2021- whatever you're up to now.
What I was talking about, the 2 a.m. that Nashville does, we do not have the same business market that they do in Nashville with all the nightclubs and all. I know that we would want to, I don't know that I personally need to move something to 2 a.m. in Knoxville versus what all the business does in Nashville. So I don't know if we wanted to extend something. I don't even know how many businesses stay open past midnight in Knox County. But, we could maybe cut it in half and go with 1 a.m. for those few that are open, just to give them some more business time. So just something to discuss. I'm not putting out yet as something to put in there, but see what people think.
So board members have question, and maybe Ms. Romer or Mayor Jacobs may have more of a pulse on this. How late do businesses stay open? How late do bars stay open? Do they stay open till 2 or 3 or 1 or, I don't know the answer to that question. I know that some during the time they weren't supposed to be open were open till 2 or 3.
Seems like this is the wrong crowd for that question, Dr. Gocher.
I think under the current regulation, and correct me if I'm wrong, but any restaurant serving food has to cease in person dining or in the restaurant dining at midnight. Is that correct? Well, the issue with that is you do have some places that serve food 24 hours, even if they don't serve alcohol, because, there will be, there is a curfew anyway on alcohol sales. But I think the bigger issue is the restaurants that serve food late night and early morning.
So could we amend this back to where we would have it something that affects alcohol serving establishments and allow the Waffle Houses and other places that serve other people to at least be open, but still follow our other guidelines? So that's something and that has actually come up. I had somebody contact me about one local place that was asking. They don't serve alcohol. They're willing to have the spacing, but they'd like this to be open.
So Dr. O'Brien, I think if we utilize Mr. Sanders' suggestion on sunsetting 2021-2 and crafting a new bill or new regulation, that you can do whatever you need to do. I think that would be open for discussion. I think the hour of alcohol service would be open for discussion. I think the catering addition would be open for discussion.
The problem is we want to try to do that now because we're going to meet again in another month. And that is the biggest thing I've heard from the business people is please do not do something that you wait another month on and keep something in force that could hurt us.
Well, my point is I think they could be crafted this evening if we choose to do so.
Not that much of an amendment. I'm sorry, that's not a reasonable expectation. You would that's a substantial change, and it would need to come back before the board, in my opinion, to be approved.
No, I agree with you, Dr. Buchanan, because what I think we were discussing was sunsetting 2021-2 and basically utilizing the framework of that with the changes that we talked about and offering that. So really it's the same amendment with the changes that we're discussing. That might be possible, might not.
Dr. Gocher, what is, Dr. Buchanan, what is the motion on the floor, Dr. Buchanan?
Motion on the floor is to let social gathering sunset and edit and modify the 2021-2, which is the restaurant occupancy limitation and early closure regulation. I guess with that, I would have, it would also have to be extended.
Have we had a second on that? It's been a long time since Dr. Sousa seconded that. So we have a motion and a second to sunset and reconstruct, I guess in basic terms. So I think that's what we're discussing.
Yes. Dr. Buchanan, would be open to an amendment to leave everything as is, your motion as is, but moving the closing time back to a compromise of 1 a.m.?
Sorry, Chair just had to go get her charger. Yes, I'm amenable to that amendment.
And Dr. Sousa is the seconder. Are you okay?
That's fine.
We consider that as a friendly amendment. So we're looking at basically recrafting 2020. I don't know if that's the right legal term, recrafting, but that's what we're doing. 2021-2 and 2, I assume 2021-3 possibly. Mr. Sanders, you may know what
I don't keep track of them without a program. So whatever you're up to now.
Well, okay. I don't think we're at 3. I think that would be probably 3. Any further discussion? Is everybody clear about what the intention of this motion and second is?
I know I'm not clear what the motion. I know what I said, but I'm not clear what you think you're voting on. So, Dr. Gocher, can you tell us what you intend us?
I didn't offer this forward or second it, but this is my impression. My impression is that 2021-2 would be allowed to sunset, which it will tomorrow. And we would have a replacement regulation which would incorporate the discussion on the catering industry as you had outlined, and would also change the time of closure from 12 to 1 a.m. Is that the board's understanding what we're discussing?
Yes.
I'm getting thumbs
Hey,
up.
thanks for clarifying my motion. Thank you.
Okay.
Because that was not what I understood.
Did we not get it right?
Based on the board's reaction, you did, yes.
Okay. I was looking for your thumbs up. I didn't see it.
So Dr. Gocher, we would insert language in the pertinent paragraphs, including event halls into this.
Yep. And where we would have catering / event halls, it would be encompassing of the catering event industry. That would be our intention.
I guess event venues, the better term, sorry about that.
Yeah. And then, the changing of the closing time to 1 a.m. So we are still discussing that. Any other discussion, comments, questions? Are we all as a board clear about what the vote is about? I sense that we are. Any other discussion about it at all?
We better vote on it before we change our mind.
Let's
Well,
do it.
when do you want it to go into effect and when do you want it to sunset?
Well, 2021-2 will sunset tomorrow. This one will sunset when? What's the pleasure of the authors or seconders?
I don't know.
Can it not
Maybe after our next meeting.
begin? Yeah.
So does anybody have a calendar? What's the next meeting?
April 21st.
So go Friday, whatever the normal time is, to 4 weeks to the Friday. Figure that out, somebody, please.
Does somebody have a specific date on that?
April 16th is the Friday. Well, let's put it this way. A month from now is 1, 2, 3, 4. A month from now is April 14th. It's a Wednesday. So the Friday would be the 16th.
Okay.
Well, wait a second. Do you all meet on the third Wednesday, right?
Yeah.
Oh, right. My bad.
So that's the 21st.
That's 21st.
So sunset at
20
11:59 on the
22nd.
22nd. Mhm.
Everybody clear on that? So we have a sunset date on that then. Any other discussion, comments? Are we ready to vote? I think we are. Ms. Little, if you will conduct a roll call vote for us, please.
What question? Are we going to vote on these things separately? One, what we're just talking about, and then letting the social gathering sunset? Does that need to be a separate vote?
You don't have to vote on it. If we
We're
don't
just going to
do
let it sunset. That's right.
Take no
Okay,
motion.
thanks.
Vote required.
Never mind.
So
I'm
basically,
tired.
we're replacing it, but that's our new measure that we're going to have is 2021 probably -3. So we're good. We're all clear on it. Are we ready for a vote? Ms.
All right.
Little, conduct that roll call vote for us. Thank you.
Thank you. This is Anderson Little with the Knox County Health Department, and I am ready to take the votes. Dr. Drake.
Yes.
Okay. Dr. Gocher.
Yes.
Dr. Hurt.
Yes.
Mayor Jacobs.
Yes.
Dr. O'Brien.
Yes.
Dr. Shamia.
Yes.
Dr. Souza.
Yes.
Ms. Wagner.
Yes.
Dr. Buchanan.
Yes.
And Ms. Roma.
Yes.
All right. We have another unanimous pass. Thank you.
Thank you. We have passed a new regulation, which will supplant 2021-2. We need to circle back. I think the way our discussion has led us is we were out of order just a little bit. We need to have any discussion that we need on COVID-19 face covering regulation 2020-1. Remember, this one is not sunsetting, so we always open this up for board discussion to see if there's any discussion about it, any problems, any considerations.
No discussion necessary. Just
None necessary. Exactly.
leave it as is.
Okay. Okay. So the next order of business is going to be item C on review and discussion, and that's COVID-19 social gathering limitation regulation, which expires March 18, 2021. And it's 2020.
It will.
Yes, sir.
It will. We've already discussed that.
So
It's sunset.
any other discussion on that? It sounds quiet. Okay. So without a motion to advance that, it will be allowed to expire tomorrow then. The next item is any other business that we have before us as a board tonight.
Dr. Gocher, do we need to discuss November 10th meeting minutes of 2020?
Yes,
Or was that-
I'm sorry, Ms. Roma, we have jumped 2 slots on that. So we needed to go back. Remember, there was an error that Dr. O'Brien, I believe, had pointed out in that, and we had approved it, but we were not aware of that change. It was either in time or date, as I recall. So let's open that for discussion. Dr. O'Brien, you may want to just fill us in on that.
I'm going to admit something. I did not submit that formally for this agenda, and it was to just change the time. We had the wrong hour listed, and it was to change it to the actual hour that was in place at the time. So I did not submit that in writing. That is on me. So I don't know if we want to do it right now because they'll never put it in writing. It was just to change from 11, from 10 to 11 or 11 to 10. I can't remember even right now.
Yep.
Actually, we looked at it today, and it was actually in a description of the situation, and I either said or someone wrote down the incorrect time. So it's actually just in the narrative piece of the minutes, needs to be changed from 10 to 11 because at the time we were at 11 o'clock curfew, and I probably misspoke and said 10.
Well, and that was, again, brought up because of a hearing attorneys
Right.
caught it and the hearing officer caught it. So
if somebody wants to put that in the form of a motion in a second, we can discuss it if necessary and vote on it, and it'll be cleared up.
Charity is going to pull up those minutes so I can show you exactly what we're talking about.
Okay.
So Charity, it's down in section 10. And if you look, Charity, they can't see my screen. Can you show them under B in the narrative piece, if you could highlight 10 p.m. in there? So what we do is change that from 10 p.m. to 11 p.m. to reflect the correct curfew at the time. So I'll make a motion that we amend these minutes to reflect 10 p.m. Instead of 11 p.m. See, that's what I want to say. 11 p.m. instead of 10 p.m.
Mayor Jacobs, a second.
We have a second. Any discussion on that? Hearing none, I think we're ready for a roll call vote. So Ms. Little,
Thanks, Charity.
conduct that, please.
Absolutely. Dr. Drake,
Yes.
Dr. Gocher,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
yes.
Dr. Shmia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan,
Yes.
and Ms. Romo.
Yes.
Thank you very much. One more full pass. Thank you.
Thank you very much. So we've corrected those minutes. I think we've covered all the topics unless there's something that I have missed. I think we've covered all our topics for this evening. We're now at other business. Is there any other business to come before our Board of Health this evening?
I have some other business, Dr. Gocher.
Yes.
So I received an email from a member of the Rotary Club, and they are, and I actually have the letter. I should share that with you all. I just got it this week. The chair of the Peace Committee of the Rotary Club would like to recognize the Board of Health with a resolution of special appreciation. The letter explains a little bit more. What I need from the board is in June 8th or June 22nd, they would like a representative from the board to accept this recognition. So I just wanted to bring that before the board to decide who would represent the board. I believe it's a lunch meeting.
And Dr.
So,
what was that date again?
June 8th or June 22nd.
And they haven't figured it out, or is there two?
And it's a Zoom meeting, so it's not an in-person meeting.
Okay. I mean, I would be willing to do that unless somebody else would be more willing to do that.
That would be great. I can make sure you get that letter.
Okay.
Gocher. Has a little more detail in it.
It's very nice of them to have done that.
Yes.
Yeah, it's quite something.
The letter says it more eloquently than I did.
Any other business to come before us this evening? So our next meeting is going to be on the 21st. Is that it?
21st.
21st. So look forward to seeing everybody then. Sooner if there's something that comes up that we need to go over, but until then, we'll entertain a motion for adjournment in a second, and then we'll plan on seeing everybody in about a month.
I make a motion that we adjourn.
Second.
We've got a motion in a second, and I will see you all in about a month. Thanks very much. Have a good evening.